Well, I've been in orthopedics for 40 years, and I can't tell you how I'm excited about this product. It's one of those revolutionary products that only comes along once in a while. And this is truly going to replace 95% of the cast or the walking boots that we put on patients. There are so many advantages to it, and there's so many disadvantages to a cast or a walking boot. First of all, it's stable. So it locks around your shoe. It's an outside brace, not inside your shoe. So you can wear a comfortable shoe, like a jogging shoe or a work boot, and it fits outside, not inside where you get irritation, sores, things like that. And then it Velcros in. So, and it's got the side struts, so it locks your ankle in, so it gives you complete stability. A cast gives you complete stability, but you can get cast sores, morbidities, problems. A walking boot, your foot is basically sloshing around, and so this gives you the stability you want. Secondly, it's functional. We can make it so that it's set at 90 degrees with a Chicago screw so that it doesn't move, so it's fixed, or we can make it into a cam, to a motion, so it can create range of motion. So you can have it either way. So you can use it for 4 weeks on a fracture locked and 4 more weeks with range of motion if you want motion. Thirdly, it's adaptable. If you have your right leg that's injured and your ankle shattered, let's say, and you're going to do surgery on it, so you can measure the left ankle, the left foot, and you can just reverse the images, and so then they can fit it for you with your normal foot. Fourthly, there's no morbidity, as I was pointing out with the cast. Diabetics get sores. Nobody likes a cast. In my 40 years of orthopedic surgery, I changed cast constantly because there's so many pressure points. With walking boots, they're just, your foot goes around sideways, they're uncomfortable. They weigh 3 pounds. This brace weighs 12 ounces. So you don't have that particular problem. Lastly, you got to talk about the indications. The indications are for anything that pertains to the ankle, whether it's non-traumatic or traumatic. Such that, let's say you take the non-traumatic. I have a neurological patient that had resolving Guillain-Barré, and she was so weak in her ankles that she fell and broke her wrist. She couldn't wear the walking boots because they weigh 3 pounds if she was in a wheelchair. You couldn't put cast on her. Within a week after I put these on both sides of her feet, locked her ankles in, she was back feeding her horses. Now, she wasn't running to feed her horses, but she was functional. This allows you to be functional, to go to a grocery store, to walk on any surface. Like this surface here is linoleum. You can walk on it. Or at a factory. You can't return to work with without a steel-toed shoe. You can't return to work with a walking boot or a cast. But with this you can, because the basic bottom surface of the shoe or your walking is, the only contact is this one piece of rubber, the strap of rubber. So it's indicated for anything neurological, non-traumatic, such as osteoarthritis, rheumatoid arthritis, chronic ligament laxity, posterior tibial tendonitis, all the indications that are non-traumatic. Now, it's indicated for all traumatic events too, such as you have a grade 2, grade 3 ankle sprain, okay? It's indicated for any kind of fracture. Let's say you have a stable fracture, medial malleolar, lateral malleolar fracture, whatever. This will lock your ankle in as well as a cast, much better than a cam walker or a walker. And let's say you have an unstable fracture. You may want to use this with no weight bearing, and then at 4 weeks, let them walk on it or her walk on it, and then start the range of motion, whatever. So there's basically any indication. That's why I honestly believe this device will replace 95% of cast or walking boots. And I think I got to give credit to Mike Bean, the inventor of this. He's a trainer at Notre Dame. He's been there probably 30 years. And believe me, he's much smarter and much more creative than I am, okay? And so I'm just picking up on his ideas. and the smart people's ideas, and using my 40 years of orthopedic surgery to bring this to the market. And believe me, there's not a patient I've met so far, and I put about 20 of these on, that hasn't said that it's much better than the walker or the cast they were using. And they honestly look at me and say, thank you.